Hey, Dr. Seema here. I want to speak to you about the six main symptoms associated with sleep apnea. What would you feel if you had sleep apnea? Let's take a look at this chart here. So, one of the first things you might notice is snoring. And whether it's a gentle snoring, but you never used to snore, whether it is a moderate snoring, whether it's an interrupted, loud snoring with, it sounds quite aggressive, you have to be very cognizant and aware of what those sounds are because there probably was a time in your life when you didn't snore and there's been a change. And it probably wasn't a hard tissue change, it was a soft tissue change, whether it's from inflammation, fat deposits, or change in tongue position. So you have to understand the snoring is the sound makes when air goes through, and you have to know and be able to analyze what that sound means. The second thing is your breathing may pause while you're sleeping. A partner may notice this. You might just say, well, you stopped breathing for a while. Like, I don't know what was happening. You're making some weird sounds. And that is actually a very serious thing because you're entering almost like a state of apnea where you have no oxygen. The other thing you might find up waking up repeatedly. You wake up, you change your position. It could be just something unnoticed. You could have like a little bit of awakenings. You can also have micro awakenings, which you're not even conscious of, but they're happening as your sleep and oxygen levels are being interrupted. You might wake up feeling short of breath. You might just feel like you're choking, having like a full apneic event, and then like a gasping of air, and it's quite aggressive. And you might actually be aware of that, or your partner may be aware of that. The other thing is unusual breathing patterns. Whether your breathing is very rapid or just irregular, that is an indication of a loss of the general smooth rhythm of good breathing. The other thing is really to be aware of, especially in women, is daytime sleepiness, drowsiness, or extreme fatigue. Now, once you hit menopause, most of us are tired. But that level of fatigue that only is relieved from a deep nap or a long nap, or you have to just kind of get yourself back into a restorative sleep mode, that is usually an indication of some form of sleep apnea. So, this gives you an idea of what the six main symptoms are, and you really have to be your own advocate and be aware of what is happening in your body and how you're feeling. Because whatever level of sleep apnea you may have, one of the first things you're going to go to your doctor with is like, I'm not sleeping well. I'm observing, and you can go through this list with your doctor and say, these are the things that I'm observing. And perhaps it's time to have a sleep study, either clinic based or home based, and have that conversation with your doctor. Take a look what's coming up with us. We're going to be on YouTube, Facebook, and LinkedIn next year. In the meantime, we're on Instagram, your.mouth matters. I'm Dr. Seema Agarwal. Lots to smile about, lots to talk about because your mouth really matters. Take care and talk soon.